Wheeling Hospital HIPAA compliance training. What is protected health information? Health information means any information, whether oral or recorded in any form or medium that is created or received by a healthcare provider, health plan, public health authority, employer, life insurer, school or university, or healthcare clearinghouse, and relates to the past, present, or future physical or mental health or condition of any individual, the provision of health care to an individual, or the past, present, or future payment for the provision of health care to an individual. Individually identifiable health information is information that is a subset of health information, including demographics that can be used to identify the individual. HIPAA protects individual identifiable health information such as name or partial name, address or zip code, social security number, birth date, telephone number and fax number, email addresses, medical record and account numbers, diagnosis, employer, relatives, billing information, and photos. HIPAA is the Health Insurance Portability and Accountability Act of 1996. HIPAA is a federal law imposed on all health care organizations, including hospitals, physician offices, home health agencies, nursing homes, and other providers, as well as health plans and clearinghouses that protect patient health information. HIPAA assures the patient has the right to request access to health information, to request to amend their health information, to request restrictions to information sharing, and to request accountability of disclosures. HIPAA protects by requiring covered entities to implement security measures to protect improper disclosure of health information. HIPAA requires covered entities to set limits on user access to individual health information, and HIPAA requires covered entities to implement training programs for employees on how to protect health information. Why is privacy and security training important? Healthcare workers employed in hospitals, clinics, and other places access patient medical information for the purpose of treatment. Apart from treatment, they can access the patient records for other purposes, subject to the various guidelines that have been stipulated by the Health Insurance Portability and Accountability Act. If you are a healthcare professional, you may require the permission of the patient to access their records for any other purpose apart from treatment. Most of the violations that happen are due to lack of awareness about the various rules and regulations of HIPAA. However, lack of awareness cannot be an excuse for the violation, and you may have to pay hefty fines, imprisonment, or both, depending on the nature of the violation. Top 4 reasons why HIPAA training is important. 1. When healthcare workers are well versed in the various provisions of HIPAA, it can result in better compliance and fewer violations. The number of unintentional violations can be significantly reduced when you undergo HIPAA training. 2. You become aware of the privacy and security rules of HIPAA. These rules specify the type of safeguards that need to be followed for ensuring the safety of physical and electronic records of patients. 3. The training can provide healthcare workers the confidence they need when they process and transmit the medical records of patients. Employees who are properly trained may be able to provide better service, and this can help build a reputation and professional image of the healthcare organization. 4. Most healthcare workers access patient records on a daily basis, and it is important that they are aware of the types of violations so that they can avoid them. Violations of the various guidelines of HIPAA attract heavy fines and imprisonment in some cases. If the violations happen repeatedly, then you may even lose the license to do business. It's not just about HIPAA, it's about doing the right thing. We should treat personal electronic data with the same care and respect as weapons-grade plutonium. It is dangerous, long-lasting, and once it is leaked, there is no getting it back. It is everyone's responsibility to take the confidentiality of patient information seriously. Anytime you come in contact with patient information or PHI that is written, spoken, or electronically stored, you become involved with some facet of the privacy and security regulations. Ask yourself the following question. Do you need to know this PHI to do my job or provide high quality care? If the answer is yes, look or listen only to the information you need and protect the confidentiality of that information. If the answer is no, you must not access the PHI. Always remember, what you see here and hear here stays here. The privacy rule protects individually identifiable health information held or transmitted by a covered entity or its business associate in any form or media, whether electronic, paper, or oral. Individual identifiable health information is information that relates to the individual's past, present, or future physical or mental health or condition, the provision of health care to that individual, and that identifies the individual. HIPAA dues. Do keep all information you hear about a patient to yourself. Do dispose of patient information by placing in properly designated shredder bins for destruction. Do contact a compliance officer, Bruce Archer, if you have any questions. HIPAA don'ts. Don't tell anyone what you may overhear regarding a patient. Don't discuss a patient in public areas such as elevators, hallways, or cafeterias. Don't look up information about friends or relatives. Electronic safeguards. Never leave your computer or pod unattended with patient information displayed. Always lock or log off your computer. Never share passwords. Never write passwords down. If you think your password has been compromised, report it immediately and have your password reset as soon as possible. Password protected and encrypted files. Always encrypt and password protect CDs or DVDs that are sent outside of the facility. Never use portable drives or USB drives to save patient information. Wrong fax number prevention. Confirm that fax numbers are correct before sending information to prevent wrong delivery. Always confirm that a confirmation of receipt is received on the fax. Make use of a cover sheet. Personal iPads, smartphones, and computers. Never look up patient information on one of these devices. Patient health information must be secure against threats to inadvertent disclosure, integrity, or availability. Facebook and other social media. Never post patient data on your Facebook page. Do not post or tweet or blog about patients. Do not discuss medical conditions online. If you wouldn't say it in an elevator, don't put it online. Do not exchange personal data. Refer to the Social Media Policy number 32 of the Wheeling Hospital Administrative Policy and Procedure Manual. Improper disposal of patient records. Paper PHI should never be thrown in the regular trash bin. Placing PHI in trash bins or dumpsters is not a secure method of disposing of PHI. Failing to shred patient information before disposal could lead to dangerous consequences. Always dispose of paper PHI in designated shred bins. Release of the wrong patient's information. Although it may seem obvious, the release of incorrect patient's information can occur through careless mistakes. If the facility contains records for two patients with the same name, the medical record staff must be trained to correctly file all medical records and release documents only for the authorized patient. What does HIPAA say to employees? The line between healthcare provider and employer is clear. Information obtained to provide health care should not be used in the hospital's role as an employer. Hospital employees are required to follow the same rules to gain access to their own health information as a non-employee. Do not access your own health records. Breach notification rule. The HIPAA breach notification rule requires HIPAA-covered entities and their business associates to provide notification following a breach of unsecured protected health information. Similar brief notification provisions implemented and enforced by the Federal Trade Commission apply to vendors of personal health records and their third-party service providers pursuant to Sections I 3407 of the HITECH Act. Definition of breach. A breach is generally an impermissible use or disclosure under the privacy rule that compromises the security of privacy of the protected health information. HIPAA violations and enforcement. Both the hospital and individual employees face substantial fines for violating HIPAA. In addition, employees may be held criminally liable. A privacy rule infraction can be considered criminal and may lead to prosecution by the Department of Justice if someone deliberately acquires or discloses a person's health information. The fine is $50,000 and up to 1 year in jail. Whenever an offense is committed through deception, the fine is $100,000 and the jail time is 5 years. And if person's health information was sold, transferred, or used for profit making or any type of personal gain or intent to harm, the fines can go as high as $250,000 with imprisonment for up to 10 years. Conclusion. Most of us believe that our medical and other health information is private and should be protected, and we want to know who has this information. HIPAA gives you the right to protect your health information and sets rules and limits on who can load and receive your health information. To report a suspected HIPAA violation, contact your supervisor, manager, director, or senior administrator. Contact Human Resources at 304-243-3213. Contact the Corporate Compliance Officer, Bruce Archer, at 304-243-2969, or contact the Compliance Hotline at 800-273-8452.